All right, now that the holidays have come to an end, health experts are concerned that the tripledemic infections for COVID, flu, and RSV will spike up as a result of holiday celebrations and, of course, travel. Joining me now is Dr. Malathi Srinivasan, who is a clinical professor with Stanford Medicine. Thank you so much for joining us this morning, Doctor.
Well, Happy New Year, Liz. It's great to see you.
Happy New Year. All right, we know that COVID, RSV, and the flu are still a concern, but is there any one particular disease or virus that we should be most concerned about right now?
Yeah, Liz, with all of the New Year celebrations and holiday gatherings, we're really expecting an unprecedented surge in respiratory illnesses in the next 2 weeks, probably even more than Thanksgiving and the highest in a decade.
Wow.
And we're expecting that the big three are going to peak probably sometime in late January after people get sick and then they infect their friends and family as well. And I'm most worried about influenza because the outpatient treatment for influenza, Tamiflu, is in very short supply. It began surging in October and has caused over 200,000 hospitalizations and almost 10,000 deaths so far.
Wow.
RSV is just kind of close behind it, surging about 4 months earlier in September. And that's caused so far about 6,000 to 10,000 deaths. So the only good news is that we should have some immunizations for RSV by sometime next year.
Yeah, that would be great. And it's estimated that 95% of Americans have COVID antibodies. Does that mean we'll have less severe COVID surge in terms of severe illness, you think, this month?
I think that what we'll see is overall less severe COVID infections because of a combination of both past infections and vaccinations, and people's immune systems are ready to fight this infection when they get it. But the only thing is the current strain, which is XBB, which is about 40% of what we have in the US right now, up from 20% just a week ago, is pretty different than the Omicron strains that are in the bivalent vaccine, but we should still have partial immunity. But because of the sheer numbers of people who are getting ill, we're still expecting to see about 300 deaths per day from COVID itself, and the long COVID risk is still the same.
Yeah, it's very scary to still be talking about this. I want to go back to the flu because you said that was of top concern. The government is releasing reserves of Tamiflu, and stores like CVS and Walgreens are limiting the purchases of the over-the-counter children's medicine. In a pinch, if you have a sick child at home, is it safe to give adult medication to young children?
Yeah, so yes and no. First,
Okay.
Giving adult medication to children should only be done with the advice of your child's doctor because of the medication side effects and toxicities. And you've got to get the dosing right, and it's weight-based for Tylenol and ibuprofen. These adult pills are very hard to cut, and especially for small children, it's hard to get the dose right, and it's easy to overdose a child. The important thing to remember about this is that these medications are symptomatic treatment. They actually don't treat the illness, the over-the-counter medications. And fever is a natural part of a body's way of fighting an infection. So you want to keep your child comfortable, but you don't necessarily need these medications to do it.
Right. That's a great advice, is that you should a fever is actually a good thing just as long as it doesn't get too high. A lot of kids are heading back to school this week. Parents are going back to work. Any kind of good tips for trying to prevent maybe catching some of these colds that kids are going to bring into school, catching some of these viruses also at work? Should we go back to wearing masks?
Yeah, I think that in any indoor closed space, you should definitely be masking. If you're in close contact with people, because we don't know how many people are around us are ill. The other thing is if you do actually get a cold and you can't find any medications, there's a bunch of do's and don'ts that parents can do to keep their kids comfortable. And a couple important things for the don'ts is that if you have a child under 5, don't give them any combination cold and flu medications because of the side effects. Don't give honey to kids who are less than 1 year old. Aspirin to kids, and don't give aspirin to kids who are less than 6 years old because of a link to a rare condition that causes swelling of the liver and the brain for kids and teenagers who have colds and chickenpox. And the things that you can do is you can bring down temperature with mild lukewarm water or cold compresses, but you don't want to make the bath too cold because children, if they're shivering, will actually drive up their temperature. So, from getting rid of mucus with those nasal suction bulbs, which I know every parent loves, to doing some irrigation or some albuterol if your airways are tight and people are coughing. There's a lot of things that people can do that are not that are non-pharmacologic to be able to keep your child comfortable.
Yeah, those are great tips. We all should be writing those down. All right, Dr. Srinivasan from Stanford Healthcare, thank you so much for joining us.
Thanks so much, Liz, and Happy New Year.
You too.